The Therapy Manual Textbook of Jmmt compiled by Saburo Sasada, Ph.D. of Acupuncture, SNESVI, Tsukuba University, Japan. Sponsored by JICA, August 2013. Contents Forward. Chapter 1. Sitting Position, Chair Massage, Chapter 2. Prone Position, Chapter 3. Supine Position, Chapter 4. Side Position, Chapter 5. Optional Methods of Jmmt, the end of contents. Forward. This is a basic therapy manual of Jmmt, Japanese medical manual therapy, which covers both general health massage and medical therapy. Japanese original manual having stroke in every region, so please add stroke at the beginning and the end. The thumb kneading is often used in Japan, and there are two types, round kneading and straight kneading. The round kneading is for reinforcing energy at the deficiency and removing energy at the excess. Chapter 1. Chair massage is recognized as a digest version of Jmmt, and you can learn various skills in sitting position. It takes about 15 to 20 minutes. Chapter 2, Period 3 and 4 are covering whole body general health manual therapy. After obtaining rhythmic relaxing techniques in 60 to 90 minutes, you can extend to your own modification way. Chapter 1. Sitting Position, Chair Massage. 1. Introduction. Practicing the chair massage is an appropriate way, as an initial teaching manual of Jmmt, Japanese medical manual therapy. Because of that, students who, not only practitioners, but also recipients, are easy to learn the techniques and procedure with their awakening mind. They can learn basic major techniques with developing talking hands of Jmmt. The appropriate time period of chair massage takes 15 to 20 minutes. B. Preparation and awareness. 1. The client sits or rides a chair with facing the chair back. Putting a cushion between them is preferable. The masseur stands at the back side. 2. The shoulder is covered by a cotton cloth, tanugi. Basically, this dry massage is not done directly to the naked skin, but done upon the tanugi. Because using clean tanugi is hygienic, and the client feels more comfortable. 3. Rhythmic technique should be applied. The rhythm, 2 times per second, is consisted of soft/deep pressure and non-stop/seamless movement. 4. The pressure should be soft and deep. It means the power come from therapist's gravity point, the second chakra. The practitioner should image the gravity point, and having good posture with relaxation, and then the therapist can promote the best healing power. Remark: see the document Traditional Complementary Medicine, How to Develop Your Healing Power. 2. Manual. Technical procedure. 1. Grip and lift on shoulder top, both side of the shoulder top for 5 seconds, and 2 times. 2. Thumb walk. Catwalk. Thumb walk along the erector spinae muscle is done in vertical 3 lines between C7 to T7. It should be done by squeezing with 4 fingers. The 3 lines are 0.5 inch lateral from midline, the inside edge line of scapula, and the center line in the between. 3. Simultaneous thumb pressure between T7 and L4. Rhythmic, soft, and deep pressure should be done along erector spinae, the first BL line. 4. Thumb straight kneading along inside edge of the scapula. BL43 is a major point, the second BL line. 5. Thumb round kneading focusing hard tissue and pressure on C11, which is origin of infraspinatus. 6. Palm heel round kneading between C7 and L4 along erector spinae, and later on, along latis semidorsi. The techniques should be seamless and consistent. 7. Cross-arm pressure on the interscapular region. Palm heel pressure should be done along with natural breathing, stretching rhomboids. 8. Thumb pressure on the neck along superior nuchal line, supporting client's forehead by one hand, and give pressure on 4 points, on Min, GB12, GB20, and BL10. 9. Palpation and pressure checking imbalance of structure or function along neck trapezius, and giving extra thumb pressure. It is the most sensitive region. You have to avoid painful techniques, and to give soft and deep pressure. 10. Neck traction in the client with lookup position, putting thumbs on GB20s, and 4 and middle fingers on temples, and giving traction towards ceiling gently for 5 to 10 seconds. 11. Grip, lift, and kneading on arm muscles on deltoid, triceps, biceps, wrist flexors, and wrist extensors. You should use palm muscle power and do not use the fingertip power because it's painful. 12. Wrist and palm hand washing for relaxation of palm heel. Be up close and down open for relaxation of the wrist joints. Fan, same as above. 13. Shoulder joint traction setting least packed position, LPP, and giving traction for 10 seconds. The shoulder joint should be 45-degree inflection, abduction, and rotation. 14. Stretching the arm and giving pressure on BL43 for 10 seconds. The client's gravity line never moved. 15. Percussion on the shoulder and back awakening and refreshing techniques should be given. Remarks. 1. Movement techniques should be done while exhaling. You have to keep good foot stance and posture. Feeling body gravity line is helpful for better performance. 2. Palpation between C5 and T3 is important for the medical massage. You have to check imbalance in structural and physiological way. According to yin-yang type differentiation, giving extra techniques on the particular region. 3. Yin-yang type differentiation, e.g., the type yang having strong body and prefers air conditioning and cold drinks, but the type yin having weak body and prefers electric fan and hot drinks. 4. Extra techniques. Say thumb rocking, non-stop rhythmic, 2 times per second. It is good to the type yin who is suffering from chronic pain. B. Knuckle rolling, same rhythmic non-stop techniques. It is good for the type yang who have hard muscles. See the 45-degree law. Non-stop rhythmic techniques are performed by having 45-degree between therapists for arm and massage moving line. Another 45-degree law is performed between the acromion segment line in the therapist and the client. Chapter 2. Prone position massage. 1. Introduction. A purpose and role. It is appropriate position for giving strong power massage, but you have to be careful not use for weak body, like osteoporosis clients. If a client body is strong, type yang, and prefer prone position, then start with this position as appropriate. It is usually used for male clients. Although, if a client body is weak, type yin, then supine or side position should be better. It is especially used for elderly or female clients. Apart from the basic principle, and if we think about real clinical situations, many clients have mixed symptoms both of type yang and yin, then all 4 positions, sitting, prone, supine, and side, are often used. B. Preparation and awareness. Shoulder and neck. Putting double cushions under the chest, 1 cushion under the ankle, and 1 small cushion under the forehead. 2. Lower thoracic, lumbar, and lower limbs. Taking out cushion under the chest. 2. Manual, technical procedure. A. Shoulder and neck. 1. Grip and lift on shoulder top. The therapist's hands should check flexibility and hardness of the client's muscles. 2. Thumb walk, catwalk, 0.5 inch and 1.5 inch lateral from midline. 3. Thumb kneading along inside edge of the scapula. BL43 is a major point, the second BL line. 4. Thumb round kneading focusing hard tissue and pressure on C11, which is origin of infraspinatus. 5. Palm heel round kneading between C7 and T7 along erector spinae and later on along teres major. The technique should be seamless and consistent. 6. Cross-arm pressure on the interscapular region. Palm heel pressure should be done along with natural breathing, stretching rhomboids. 8. Thumb pressure on the neck along superior nuchal line, supporting client's forehead by one hand, and give pressure on 4 points on min, GB12, GB20, and BL10. 9. Palpation and pressure checking imbalance of structure or function along neck trapezius and giving extra thumb pressure. It is the most sensitive region. You have to avoid painful techniques and to give soft and deep pressure. Remark. Spinal disalignment. Between C5 and T3, there are often observed spinal disalignment as a chronic stiff neck and shoulder. Smooth and well-skilled palpation should be done. You should give deep and soft pressure in the best position. Therefore, you should adjust the best angle of the neck rotation. B. Lower thoracic and lumbar region. 1. Caterpillar, palm heel pressure, and round kneading. From level T7 to S2, the palm heel is on one side of erector spinae and focusing the power reaching to the gravity line to relax the core muscles. 2. Netting by palm, heel or thumb, along the same line, to relax hard tissue of superficial and middle layer. 3. Pressure by palm, heel or thumbs, on the hard tissue of deep layer. Remarks: A. An immediate strong pressure may damage the tissues, inducing stretch reflex. Therefore you always have to give pressure soft and deep while approaching deep tissues. B. The pressure massage on lower limbs, especially on hamstrings, can relax hard tissue of thoracic and lumbar region. Therefore massage lower limbs first and pressure massage on the back later is safer and rational way and appropriate procedure. C. Buttocks and upper legs. 1. Checking hard tissue and thumb pressure in the buttocks. There are 3 vertical lines, 2 BL lines, BL28 and BL53, and GB line, GB29 to 30. 2. Knuckle rolling on hamstrings, holding an ankle by one hand. Keep 20 to 30 degree flex of the knee and knuckle rolling by another hand along outside and inside muscle lines. 3. Long pressure on BL36 and 40. BL36 can be pressed by thumb or knuckle, and BL40 should be pressed by thumb. S. Remarks: A. Regarding manner, this region is sensitive part. Because of close to private part, you have to give techniques with polite and convincing way. B. Pressure with stretching. The pressure of BL36 and 40 are effectively done by stretching the Achilles tendon. The lower leg and foot. 1. Grip and lift of the calf, the origin part of gastrocnemius, for several seconds, and quick grip and lift goes down to the insertion part. It is done for relaxation of the calf muscle. 2. Palm heel rolling to Achilles tendon, which are both inside and outside the knee, should be flexed 90 degree. 3. Proneus and tibialis anterior with frog position. One hand holds the foot dorsum and stretching the muscles, and another hand give pressure along GB and ST meridian, which are equivalent to peroneus and tibialis anterior. 4. Stretching Achilles tendon and quadriceps, holding the foot sole by one hand, and dorsiflex and knee flex with exhaling. 5. Stretching of hip inner muscles, holding the ankle joint by both hands, and gives 10 seconds traction. The hip joint a little medial rotated and abducted. Remarks: Frog position and pressure piriformis at the beginning of prone position. You should check having frog position or not. If having frog position, piriformis techniques is effective. At the piriformis is pressed by the knuckle, and another hand giving circumduction movement for stretching piriformis. Chapter 3. Supine position massage. 1. Introduction. It is appropriate position for the client who has autonomic/hormone imbalance, weak body, and who is woman. As an preparation, put a pillow under the head and a cushion under the knee. 2. Manual, technical procedure. A. Face, head, and neck. It is appropriate for mental stress, tension type headache, and fatigue of eyes. 1. The opening third eye, gentle touch yantang, for 10 seconds, by double thumb. It is for relaxation and pressure by image only. 2. Gentle thumb pressure on Tai Yang same, for 10 seconds. 3. Thumb pressure on GV20 same as. 2. 4. Finger support/pressure on BL10 and GB20 same, for 10 seconds. 5. Finger support/pressure on GB20 and GB12 with rotating the neck. 6. Checking hard tissue by middle finger along neck trapezius. 7. Pressure and traction, giving pressure on the hard tissue and at the same time giving neck traction. 8. Neck traction. There are 3 techniques as variations which are supporting mastoid processes, GV15, and using Tanuki. B. The upper limb. 1. Checking pulse. The wrist is slightly extended and ulnar flexed, and taking pulse at radial artery, Lu 7 to 9. The checking points are rhythmic stability, shallow/deep, and flexibility. 2. Pressure on wrist extensors, with palm on palm, stretching the extensors, and giving another palm pressure on origin part for several seconds. And then, check hard tissue along forearm TE meridian. 3. Pressure on wrist flexors. The palm is facing ceiling with supinated arm and deep pressure on PC line. Same method as above mentioned. 4. Hand reflexology. 3 techniques as same as chair massage. 5. Thumb 10 seconds pressure on HT1. If the client has chronic numbness, severe pain, or cold arm, it is used. Shoulder joint abducted more than 70 degree, and radial artery tuft by one hand, and another hand giving thumb pressure on axillary artery. See the lower limb whether the client is male or female. The techniques are different, as follows. For the male client, 1. Grip and lift on quadriceps, focusing lower half and insertion part, near the patella. 2. Knuckle rolling on rectum femoris, thumb pressure on St. 31, origin part, at the groin, and knuckle rolling on the muscle. 3. Knuckle rolling on tibialis anterior and peroneus, with stretching the foot dorsum, while one hand giving knuckle rolling, another hand stretching out the muscles and meridians. 4. Thumb pressure on St. 36 to 39, and GB 34 to 37. If you find hard tissue, then giving thumb pressure. 5. Thumb pressure on ankle crease. If you find edema, then thumb pressure, with the knee bending, GB 40 and St. 41. 6. Movement techniques. A. Stretching TFL, and gluteus maximus, holding SS, and knee with fixing foot dorsum. B. Stretching hip abductors, cross-legged position, the recipient side, and palm heel pressure, on hard tissue. C. Patella pressure on BL36, and stretching hamstrings, the hip and knee are deep flexed, and giving pressure at origin part, and then stretch out the knee slowly with holding the heel. For the female client, 1. Fascial release on the foot. A. Long stretching on the foot dorsum, with holding the big toe, and the fifth toe, and then move the 4, 3, and second toe. B. Fascial release of the foot sole, long stretching on the foot sole and calf muscle. C. Fascial release of the leg lateral and medial side, long stretching with slow and gentle movement. D. Binding legs. See the remarks. Remarks 1. Binding legs. It is effective for relaxation of deep tissues on pelvis and lumbar region. There are 3 steps as follows. A. Binding both legs at 1 or 2 inch above the knee by tanuki, and start vibrating/rocking the heels which are on therapist's forearm. The wave going up to the abdomen for 20 to 30 seconds. B. The hip and knee flex deeply. The therapist hands hold the knees and giving vibration/rocking, and the wave reaches sacroiliac joint. The wave energy given from left knee and reach to right sacroiliac, and right knee to the left sacroiliac. C. After relaxation, smoothly stretch out the knees and hold the heels, and lift up until the gluteus maximus lifting up. 2. Cross-legged. It is applied for the male client who is suffering from chronic sciatica. A. One side cross-legged, another side leg is knee bending. The hip is flexed at the border comfortable/discomfort and giving vibration/rocking for enough relaxation. B. The flexed knee side, patella pressure on BL36, and slowly/smoothly extend the knee, and then hold the heel for enough stretching for the hamstrings. C. The cross-legged side knee should be lateral rotated by the therapist hand smoothly for stretch enough. Chapter 4. Side position massage. 1. Introduction. The side position is appropriate position for the client who has autonomic/hormone imbalance, weak body, and who is woman. As an preparation, put a pillow under the head and a cushion under the knee. An additional cushion prepare for her hugging. 2. Manual. Technical procedure. A. Shoulder and neck. 1. Grip and lift the top of the shoulder. 2. Palm heel kneading along with erector spinae and palm kneading along with latissimus dorsi. 3. Thumb pressure/kneading between C7-D7 and 3 vertical lines, 0.5, 1.5, and 3 inches lateral from the midline. Therapist's one side foot is on the table, and the same side arm is supported by the knee. 4. Thumb kneading/pressure on G11. The shoulder should be supported by the forefingers. 5. Thumb pressure on Anman, GB12, GB20 and BL10, with soft, deep and stable. 6. Checking hard tissue and pressure on the neck trapezius, with the neck is flexed position. B. The upper limb. 1. Grip, lift, and rotation on deltoid, follow with biceps and triceps. 2. Thumb kneading/pressure on the forearm TE line. The hand should be supported for fixing. 3. Thumb kneading/pressure on wrist flexors, with pronation. The palm is fixed by therapist's knee, and both hands are used as walking way. 4. Hand reflexology. 3 techniques as same as chair massage. 5. Thumb pressure on the armpit, option, with holding the elbow gently, checking hard tissue first, and then pressure on it, subscapularis. 6. Movement of scapula, option, with the hand located at the back, giving abduction and adduction the scapula along with breathing rhythm, stretching rhomboids, and serratus anterior. C. Thoracic and lumbar thumb kneading / pressure. 27-L4. Use both thumbs along with erector spinae. The lower limb. 1. Checking hard tissue and deep pressure on buttock. Major points are BL 28, 53, GB 29, and 30. 2. Palm rubbing along with TFL. Major point is GB 31. 3. Thumb pressure / kneading along with hamstrings. Points are BL 36, 37, and 40. 4. Knuckle rolling along with tibialis anterior and peroneus, with fixing foot dorsum for stretching. 5. Thumb pressure / kneading on same muscles. Same 36 to 39, GB 34 to 40. 6. Thumb pressure on the opposite side leg tibialis posterior. SP 6, 4, and key 6. Palm heel pressure. Chapter 5. Optional methods of Jmmt. There are 4 methods as follows. 1. Facial release, myofascial release techniques. 1-to-1. Introduction. It is appropriate for pain relief and relaxation for sensitive and weak body clients. The fascia is a tissue which covers whole body between skin and muscles. The superficial fascia is a soft connective tissue located just below the skin. It wraps and connects the muscles, bones, nerves, and blood vessels of the body. Together, muscle and fascia make up what is called the myofascia system. Disuse, not enough stretching, or injuries, the fascia and the underlying muscle tissue can become stuck together. This is called an adhesion, and it results in restricted muscle movement, along with pain, soreness, and reduced flexibility or range of motion. Myofascial release techniques uses gentle, sustained pressure on the soft tissues while applying traction to the fascia. This technique results in softening and lengthening, release, of the fascia, as well as the breaking down of scar tissue or adhesions between skin and muscles. Many skeletal muscles attach to bones via the fascia. If our body has suffered from chronic stress, muscles get tense, shrinkage, and contracture. The fascia which is covering the muscles is also having tense and shrinkage. Therefore, soft and gentle stretch to the fascia is the excellent approach to relax and better flexibility to the body and mind. The fascial release needs to make long stretch. It is about 90 seconds. The therapist has to wait until feel relax, which means the resistance changes into relax like ice melt down into water. 1-to-2. Technical procedure. The client is supine position and therapist stands beside the side. 1. Prone position of the arm. Hold thumb and small finger with both fingers and palm as half and half, giving soft and gentle stretch for 20 seconds. The shoulder joint should be kept as the LPP position. Holding small finger change to ring, middle, and index finger slowly. While this technique, the therapist should image the kinematic chain which start finger side fascia, connectorist extensors, upper arm, shoulder, and neck muscle are going to relax. 2. Supine position of the arm. Same technique is given with supine position. 3. Mild traction of the shoulder joint, holding wrist and elbow, giving mild movement to the shoulder girdle region, and finally giving traction of shoulder joint. 4. Fascial release to the foot dorsum. Hold the big toe and the fifth toe, and same way stretch as the arm. The hip joint should be kept as LPP. 5. Stretching the foot plantar and back side of the leg, holding 5 toes and the heel, giving soft gentle stretch with mild movement of the hip joint. Feeling resistance and make relax slowly. 6. Stretching lateral side of the leg, holding lateral side of the foot, and giving the same stretch and movement to relax the lateral side of the leg. 7. Medial side of stretching, holding the heel, and giving stretch and movement to medial side of the leg. Remarks: LPP and CPP. Every joint has LPP, least packed position, and CPP, close packed position. The LPP is the most relaxing position which has the largest joint play, accessory movement. In CPP, oppositely, the joint is tight and least flexibility. The movement techniques, especially distal movement techniques, are effectively done by combining both positions. 2. Chakra vibration. 2 to 1. Introduction. This is good for the client who has weak digestion and poor blood circulation inside pelvis region. Therefore it is good for the client who has woman's syndrome and abdominal palpation. There may be low skin temperature around the umbilicus, CV 4 to 12. 2 to 2. Technical procedure. The client is supine position and putting cushion under one side knee. The therapist sits facing at the foot sole of opposite side. 1. Checking skin temperature of the abdomen. You should compare the temperature upper and lower umbilicus. In advance, you need to ask the recipient whether you can touch and check the abdomen. 2. Relaxation of the ankle and foot. It is for general relaxation purpose, giving general massage, stretch, and movement technique. 3. Big toe circumduction. It is for relax the ankle joint, holding the heel by one hand and holding the big toe by another hand, and rotate circumduction way 30 times clockwise and anti-clockwise another 30 times. 4. Chakra vibration. It is for warming lower abdomen, activating parasympathetic nerve and enteric nervous system. Hold the heel with anatomical position and touch the 4 and 5 metatarsals by another hand, and then giving tiny vibration for 1 minute. Therapist should image that the vibration reach to abdomen. 5. Checking skin temperature of the abdomen. If the temperature warm enough, then result is good. If the temperature is still cold, then you have to do 1 time more, or try to do another approach. 3. Facial massage. 3 to 1. Introduction. It is effective both rejuvenescent, facial nerve paralysis, and discomfort release from mental stress. 3 to 2. Techniques. A. Finger rocking at facial muscles. Use index and middle fingers with kneading and vibrating. The technique should be done consistent and non-stop way. The rhythm is 3 times per second. Major points are Yantang, Tai Yang, Saint 8, GB 3, Saint 7, Saint 6, and Saint 2. B. Finger rocking at superior nuchal line, via backside of the ear. Finger rocking approach to the neck with its rotating. The rocking should be done carefully from superficial, middle, and deep layer muscles, which are sternomastoid, splenius, longissimus, and semi-spinalis. The points are on Mien, GB 12, GB 20, and BL 10. C. Grip and lift by 2 fingers at the lower jaw, using thumb and index finger. Both hands are applied between the center and the angle region. Saint 5 to 6. Remarks. 1. How to use Tanuki. Facial massage should be done upon Tanuki, which covers the face, but open the nose for natural breathing. 2. Tentative theory of mental stress relief. Relaxation of facial muscles and superior nuchal line may activate parasympathetic nervous system via cranial nerves of 7 facial and X vagus nerve. 4. PNF stretching. 1. Introduction. PNF has wide-range therapy fields, and in this section, the PNF stretching is focused as one of them. The PNF stretching is the integration system between nervous and muscle system, and focusing on relaxing tense soft tissues and pain relief. 2. Basic nerve reflexes. 2.1 Stretch reflex, quick stimulation, or painful stimulation induce stretch reflex as PTR/ATR, and the tissue contract more. You should give always slow gentle pressure to the recipient. And high gravity muscles have strong stretch reflex for keep our body erect. 2.2 Reciprocal innervation, when the agonist constricts, antagonist relax and stretched. This mechanism is applied as the PNF stretch. 3. Techniques. Every method is based on repetitive resistive movement by the therapist, and it should be done regularly until the recipient body gains the exercise. 3.1 Contract relax. Resistive movement exercises done by isotonic way with 20 to 50% of max power, and the duration is for 3 to 5 seconds. 3.2 Hold relax. Very similar as the contract relax, but it is applied isometric movement and hold more than 6 seconds. 3.3 Rhythmic stabilization. The movement is as same as isometric way, but it is done alternately between the agonist and the antagonist with duration is for 3 to 5 seconds.